Hi, I'm Dr. Fox, and let's talk about the muscles of the anterior neck. In this video, we'll discuss the significant muscles of the anterior neck with an emphasis on their attachments, actions, and innervations. In particular, we'll focus on sternocleidomastoid muscles and the infrahyoid muscles. So let's get started with the sternocleidomastoid muscle, or the SCM for short. This is an excellent opportunity to discuss some of the naming conventions that we have for muscles. So if you pay attention to a muscle's name, you might have some information revealed to you, either the attachments of that muscle, what that muscle does, the shape of the muscle, so on and so forth. So in the case of the sternocleidomastoid, if we break this down, there is sternocleidomastoid. And this gives us most of the attachment sites of this muscle. So the inferior attachment sites of the SCM include the sternum, the medial third of the clavicle, and the superior attachment sites of the SCM include the mastoid process of the temporal bone as well as the superior nuchal line of the occipital bone. So SCM, sternocleidomastoid, the sternum, the clavicle, and the mastoid process are the significant attachment sites for this muscle. In terms of the actions of the SCM, we can think of it in terms of unilateral or one-sided contraction, which gives us lateral flexion and rotation of the neck. So we laterally flex to one side and the chin goes up and over. So it's a head tilt with the chin up. Or bilateral contraction of both SCM muscles will give us flexion of the C-spine, such as touching the chin to the chest. The sternocleidomastoid has an interesting set of innervations. Its motor or efferent innervation is the accessory nerve, which is cranial nerve 11. Its afferent or sensory innervation comes from branches of C2 and C3. One of the more important or classic anatomical relationships of the sternocleidomastoid is its relationship to the external jugular vein. That is, the external jugular vein crosses the SCM. And so in cases of right-sided heart failure, this EJV can become very distended or dilated such that one can directly observe it. So if you're looking at a patient and you notice a very distended or dilated external jugular vein, you may want to pay attention to what's going on with the heart. Looking more medially to the sternocleidomastoid muscles, we have the infrahyoid or strap muscles. Like I said, a lot can be said with respect to a muscle's name. In the case of the infrahyoid muscles, infra means below, and the hyoid is the bone of which all of these muscles are below. So there's the hyoid bone, and all of the infrahyoid muscles are found below it. Sometimes we refer to these as the strap muscles because of their strap-like appearance. The infrahyoid muscles may be found superior to the sternum. In fact, many of these muscles may originate on the sternum, such as the sternohyoid and sternothyroid muscles. They're also found medial to the carotid sheaths. So here we can see those carotid sheath contents there. An exception of this would be the inferior belly of the omohyoid, which will be lateral to this, and we will see that in a subsequent slide. These muscles are also superficial to the thyroid gland, which we can see here, as well as the larynx, which we can see here occluded by some of these infrahyoid muscles. The infrahyoid muscles are largely innervated by ansa cervicalis, which is a nervous structure from the cervical plexus, which we'll see. The infrahyoids are divided into two groups. There are the superficial infrahyoid muscles, comprised of the sternohyoid muscle, so from the sternum to the hyoid, and the omohyoid, omo means shoulder, which has two bellies. The superior belly attaches to the hyoid, and the inferior belly goes out laterally to the scapula or shoulder blade. And there is an intermediate tendon here between these two bellies, which is attached to the clavicle via a fascial sling. Now, these two muscles are important muscles for stabilizing the hyoid and may also depress the hyoid as well. Because of their position in the anterior neck, these muscles must be delicately navigated during surgical procedures such as tracheostomy, thyroidectomy, or carotid endarterectomy. The deep infrahyoid muscles can be found deep to the suprahyoid muscles, and these are going to attach between the hyoid and the sternum, with the thyroid cartilage of the larynx being the intermediate attachment between these two muscles. These consist of the sternothyroid muscle between the sternum and the thyroid cartilage, and the thyrohyoid muscle between the thyroid cartilage and the hyoid bone. These muscles may depress the hyoid or elevate or depress the larynx or voice box, depending on which is contracting or relaxing. The sternothyroid is innervated by ansa cervicalis, whereas the thyrohyoid is the exception here, which is innervated by C1 fibers. So let's take a look at that ansa cervicalis here. We have an illustration of the cervical plexus. The cervical plexus has ventral primary rami contributions from C1 through C4. Ansa means handle and cervicalis of the neck. So here in this lime green, we can see the ansa cervicalis come down and give off fibers to those infrahyoid muscles. The exception being the thyrohyoid muscle, which has C1 fibers, which are hitchhiking along with the hypoglossal nerve, or cranial nerve 12. So we've discussed the anterior neck muscles, sternocleidomastoid, and infrahyoid muscles. This is your summary slide. Thank you for your time.